lot of buzz has been created around the next session, intersection of modern medicine, ancient medicine, Ayurveda, and technology. Who could have been a better person than Dr. Rohit Sane to talk on this topic? He is MD and CEO at Madhavbag, India's leading chain of clinics and hospitals, which specializes in cardiac care. Though Dr. Sane studied allopathy, he followed his father's footsteps and started practicing Ayurveda. Having gained knowledge of both of the systems of the medicine, he founded Mother Bug, where the treatment principle integrates both Ayurveda and modern medicine. Sir, I welcome you.
Hello, everybody. I'm Dr. Rohit Sane. I have done my MBBS, I've done my fellowship in cardiac rehab. I am a doctor as well as an entrepreneur. So I'll just try to put on the journey of entrepreneurship that I was trying to listen from the morning itself. That many of the doctors don't try to become entrepreneurs. I tried to do it. I'll just showcase the whole journey that what came to me since 2006 till 2019 and how I've tried to go ahead with it. So the topic for today, the whole organization is about intersection of modern medicine with the ancient medicine that is Ayurveda and a combination of all these two paths due to good amount of technology that we have tried to get in for the benefit of the patients. To start with, if at all we understand the whole prevalence and incidence of cardiovascular diseases, the chronic diseases of our nation, we could know that putting respiratory diseases and cancer together, cardiovascular diseases are much more in India than these two diseases. So if at all we have to save our nation from the biggest killer that is coming inside, that's the cardiovascular disease, we have to think about something innovative by which we will be able to reduce down the burden of cardiovascular diseases on the nation. If at all we think about the interventional things, like we must have heard about angioplasties, we must have heard about bypass surgery, we must have heard about n number of interventional surgical options. And though the surgical options have been there in our nation since a long amount of time, yet the death toll due to cardiovascular diseases is constantly increasing. It hasn't reduced down. The reason we need to understand is, what we need to see is we need to have a complete ecosystem to handle these lifestyle disorders. Because a patient related to heart disease or else diabetes or else blood pressure, which are risk factors of these heart diseases, these are lifestyle disorders. Lifestyle disorders will help you to create major more disorders ahead, which we will not be able to combat against. And to combat a lifestyle disorder, what is the best thing to be done is to modify the lifestyle of the patient, which is the toughest job that is to be done for us in the future. Hence, if at all we think about this, that we need to have a complete ecosystem, what should this ecosystem be comprised of? The ecosystem should be comprised of, obviously, the modern science, the ancient Ayurvedic science, and the amalgamation of both of them with the help of technology. Many times I did ask n number of Ayurvedic friends of mine that Ayurveda, being a science which has come 5,000 years ago, but has not been the first line of therapy for chronic cardiac disorders, the reason was Ayurveda did not embrace technology, while allopathy did. So technology is going to be the game changer for the healthcare in the future for Ayurveda as well as for allopathy. And that is what we tried to do in the organization. And I'll try to showcase a journey of how and what can this technology embracing by Ayurveda can be as for the last 12 years that we are supposed to be doing. If at all we talk about this ecosystem, what should this ecosystem be about, in which the modern technology and the ancient science will come together and create wonders? What should this complete ecosystem be about? That's the smallest picture that I could put in, is the first screen them. So what have we come up with for the initial screening? we have a clear Save My Heart app on the mobile of these patients who normally screen themselves for certain different questions, and they get a clear score for their healthy heart score that we call for. Based on that score, there are clear typical advices that they get on their home, on their phones, or in their residences, free of cost. They have nothing to pay for it. As once they follow it, many of these patients will fall out of these risk factors and would reduce on the burden of cardiovascular diseases. But many of them don't follow these advices and they land up to the doctors. So the next point is the technology we try to get inside the clinics. If the patient is already into a risk factor or else a disease, the patients normally come down to the clinics, and every clinic that we have is with all these typical technological devices that our doctors normally use. We have POC devices of HbA1c, lipid profile, ambulatory blood pressure monitoring. We have stress test devices, and all these devices are Bluetooth integrated with the clinical management system that we have. And these Bluetooth integrated devices attached to the clinical management system is been connected with the MD medicine or else the cardiologist sitting on the back end in Mumbai. And all these clinics all over the nation are talking to these cardiologists through these POC devices. The cardiologist reports on these devices and the report is sent back. The stress test is also being conducted in all the clinics all over the nation, and the stress test being reported by the cardiologist through these technological devices is been sent to the patient 15th minute after his test has been done. So this is how technology has helped each and every Ayurvedic doctor in the organization. So such kind of all these devices being used by these doctors, and this technology is helping an Ayurvedic doctor to treat the heart patient through n number of various modalities. As we go ahead, these Ayurvedic doctors have a clinical management system in which when they key in the symptoms of the patients in this clinical management system, the clinical management system gives a clear advice about which investigations are supposed to be done, which medicines are supposed to be prescribed, which therapies are supposed to be prescribed. The complete ecosystem has been mapped inside the clinical management system, and the doctor gets a complete idea about what am I supposed to advise to the patient. So even if a newly taught doctor comes inside the ecosystem, the doctor is able to take the things ahead even in the rural most areas. So once the doctor advises the therapies, advises the investigations to these patients, as we go ahead, there are typical Ayurvedic therapies which have been planned for various different disorders. Now these Ayurvedic therapies, the question comes around is about standardization of these Ayurvedic therapies. How do we standardize these Ayurvedic therapies? The answer was very simple. The technology that has been explained in Ayurvedic text 5,000 years ago, the technology or else the science which has been described in the Ayurvedic text 5,000 years ago, we have converted them into smaller typical technological kits of devices and medicines which are being shipped to these clinics, and the clinic doctors utilize these therapy kits for the patients. So everywhere, wherever you go, the therapy kits would be the same, the doctor diagnosis would be the same, the advice would be the same, and the therapies would be the same. For different disorders of cardiac ailments, there are different therapies which have been proposed, and these therapies would be implemented by these different doctors all over the nation. So that is how the science has been converted into a technology, because I think unless and until the technology cannot be transferred to anybody, who is even a blind person should be able to use that technology is going to be absolutely good enough, and that is what we have tried to do. Once the patient is inside the care of this doctor, and the patient is coming to that remote most clinic every time, in a year he comes down 30 to 35 times inside the clinic with the doctor in the remotest area, Now the clinical management system that we have, this continuously monitors the patient for continuous improvement or disimprovement of the patient, where the regional medical heads sitting in the central head office do monitor these patients. Every parameter is monitored real time by these regional medical heads and advise these doctors through the telemedicine app that these things are supposed to be done along with the things that you are trying to do. So we have an expertise along with these doctors for the patients to improve the quality of life and quantity of life of these cardiovascular patients. So as we go ahead, now talking about ancillary services, like I was talking about, the most difficult thing is to change the lifestyle of an individual, lifestyle of a patient. Now, we have n number of things to say what is not to be done. That is what we consider as a lifestyle advice. But I think instead of what not is to be done, we as doctors should tell what is to be done. So if at all we advise these patients what is to be done, it becomes very easier for the patients to follow what is to be done instead of what not to be done. So here, if at all you could see, there are n number of exercise devices that you could see the video going on. That video has got a bit counterposed, I guess. But that video is about the exercise device that is Bluetooth integrated, and the patient continues doing his exercises at his residence. The data through this, the heart rate sensors, they push the data through the mobile app to our clinical management system. So even though the patient exercises at his own residence, the data comes to the clinical management system about the repetitions, about the heart rate, about the time of exercise and all this data, as well as the most important thing is about the diet. If at all I tell you not to eat this and not to eat that, the question comes out from you is, what am I supposed to eat then? So the answer is the diet kit, the technology of diet, the mathematics of diet that we have tried to put in the diet kit. That's a month-full big diet kit which is given to the patient, and the patient consumes subah ka nashta, dopahr ka khana, sham ka nashta, raat ka khana, chai, juice, soup. Everything is there in that diet kit, and this diet kit, what the patient has to follow for the whole month. For about 3 months or 4 months, the patient follows this. He changes his lifestyle, he reduces down his weight, he reverses his diabetes, HbA1c, and gets back to a normal, healthy lifestyle where the patient improves his quality of life. So such kind of various different technologies that we have tried to put all over these clinics that we have, and due to these technologies, we have tried to monitor these patients continuously for the whole year, and compliance from the patient has increased many folds. As we go ahead, the integrated clinical approach that I have explained just right now, we plan to manage, or we have been managing, the diabetes patients and monitor them with HbA1c as a modern clinical parameter. For typically hypertensive patients, we try to conduct ambulatory blood pressure monitoring with a device which is there inside the clinic. It has been reported by the cardiologist onto the telemedicine app, and the doctor sitting in the remote area gets the complete idea about the patient's report. We have tie-ups with myocardial perfusion imaging kind of techniques with the bigger hospitals to manage ischemic heart disease patients, which are coronary artery disease patients of blockages or atherosclerosis. And we have a stress test device inside the clinics which has been reported by the cardiologist to monitor and treat the heart failure patients through the parameter called as VO2 max. So if at all we take a complete approach of integration of modern medicine with Ayurveda through the help of technology, the things would become very simple for our nation in the future. And through this whole technology, what have we tried to put in is whether this would be a practically possible thing or not. Yes, it has been practically possible since last 12 years. Now Madhav Bagh, the organization, has more than about 194 clinics all over the nation in 6 states. We have more than 300 doctors, Ayurvedic doctors working with us, the BAMS doctors working with us in collaboration with the modern medicine guys with the help of technology. And due to this, as a result of this, we are able to conduct more than 30,000 stress tests every year, doing more than 3 lakh ECGs every year, more than 5 lakh of total footfall in all these clinics every year, and having a strength of about 30,000 Panchakarma cardiac services to be dealt every year with the help of these Ayurvedic doctors, from the support of regional medical heads and the allopathic doctors. So the whole ecosystem comes together, and once we come together, we were able to publish the verified data that has been thrown up by these clinical management systems. We have more than 100 research papers presented till date, and most of these research papers have been published in n number of typical journals, the Lancet, as well as we had published ourselves in the European Society of Cardiology. We have published ourselves in the Indian Heart Journal, and there are n number of more such research papers which have been published till now, the Ayurvedic services on the cardiac treatments with the help of technology and modern medicine. And that is how I think, if at all we all of us come together, we will be able to reduce down the burden of heart disease on our nation and save our fellow friends from heart attacks. Thank you. I'm open for questions.
When we are doing a VO2 max testing, right? When you're doing a VO2 max testing, would that replace a human, or even the system? There's such a system which has come up, which is tied, and I mean to say virtually, wherein the person sitting at the other end can manage directly without the physical presence. Is what I'm asking.
Not yet.
Okay.
We'll need the doctor in over there.
Yeah.
For the conduction of that stress
It's
test.
only the reports which goes back.
Absolutely.
Okay, thank you.
Absolutely. Will do. Thank you. Thank you very much.
Much using AI and machine learning for better care delivery.